that you lose up to 90% of your kidney activity. Your kidney is no longer functioning up to its optimal, and yet you are still feeling fine. It's not obvious. And because this happens in a very creepy way, I'll be answering in this video certain things to look out for and things to know when to go and things to avoid too. Because kidney failure is becoming rampant. It's no longer something you say for the elderly. Even the young people come down with kidney failure. That's why there was a case of rampant, organ harvesting, and a lot of people were arrested for. God created us with two kidneys because He knows how important the kidney is. So if you are interested to learn more, and this channel is created specifically to share health tips for health promotion and disease prevention, so stick to it. Please subscribe as I answer certain questions in this video that can help you to stay healthier and live longer. First, what is kidney failure? Kidney failure comes as a result of certain reasons, like if when your kidneys, it happens when your kidneys are no longer, kidneys are created to filter waste from the blood. Now your kidneys are no longer functioning effectively, filtering that waste. Now it's supposed to selectively filter, absorb certain hormones while filtering the waste out. So certain things like protein and waste are supposed to be absorbed back into the blood, while waste like urea, creatinine are being released back. So as a nurse, I have seen several cases, and it's usually very, 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 is of a great concern. The number of persons that troop in due to kidney failure, they have to go for weekly dialysis, depending on the dialysis machine to filter their waste. And of course, it's not cheap. So stick out in this video as I answer certain questions and things to avoid. I keep telling those around me and those who are willing to listen that prevention is better than cure. Prevention is also cheaper than cure. You are happy, you are young and healthy. You need to maintain this because your health is your wealth. So the next question is, what causes kidney failure today? One of the leading causes is high blood pressure. I have in one of my videos, I took time to explain about high blood pressure. You can check it out and then watch that video and learn more on how to prevent it. I also conducted some outreach because I am a public health enthusiast, even as a registered nurse, and I care about people around me. It's somehow you hear someone why they said maybe it could be high blood pressure, unchecked, unmonitored. I care to share this information. That's why I put up this channel, so that no more would ignorance be an excuse. We can be better and live longer. Next is diabetes, and these diseases are comorbid. Someone can have diabetes and have high blood pressure, and now kidney failure results in the long run. So we want to watch this. All these are preventable. I have another video where I talked on diabetes too, and certain factors that can be done to prevent it. Certain things we do that we don't take note of that affect us and causes that insulin resistance. It's also in this channel. You can look out for that video. Then chronic use of painkillers and herbal mixture. I tell people that you just hear there's so Dr. Gogo herbal mixtures. I'm very curious about herbals. Some people say maybe because I'm a medical professional, I'm being segregated. No, the truth is I do not doubt that herbs can cure certain diseases, but I'm also curious in the fact that the dosage, those herbs are very potent, because some of our drugs are even gotten from those herbs and then put into milligrams so that we don't overdose it. Now your kidney receives all those things. Remember I told you it's filtering waste. It filters everything that goes into the blood. And then when you take all these herbs, you don't pity your kidney, and then it results over time. So untreated kidney infections can be a cause, can be a leading factor. Then obstruction from stones or problems can be a cause of leading cause of kidney failure. If you are experiencing obstruction, maybe due to buildup of stones and the rest, it can lead to kidney failure. Then we have, what are the early warning signs? Early warning signs, we have persistent fatigue. That you're always feeling tired. Persistent fatigue can point to several factors. But it's still part of a sign, early warning sign of kidney failure. Then, now I don't know if you've seen someone who has a swollen face, swollen hands and legs. Yes, maybe you've seen someone around that you notice that sudden change, swollen face, swollen legs, ankles, and the rest. It's also a sign. Remember, when the kidney fails to filter these waste, they accumulate in the body and they go and store in these areas. Then you have reduced or foamy urine. You're no longer urinating as you should because the kidney is not filtering it, it's stored in the body, and then your urine is foamy. Then the individual begins to lose appetites and feel like vomiting. When waste is in your body, it's very, very uncomfortable. And every waste, God designed it that they must be removed from the body. So these are then there are ardent red flags when you do not urinate at all or urinate very little. In a day, we are supposed to urinate about 1,500 mils. Well, most times we don't measure it, we just go use the toilet and the rest, and on and on. 1,500 mils is like that big ever bottle of water. Those who know that, like it's sold in my country. When someone is beginning to, go into confusion and the rest, that the waste have gone as far as reverting back to the brain, because when these wastes are not well filtered by the kidney, the blood still carry this waste and continue spreading it all around, contaminating everywhere. So it affects several other organs, especially the brain. Now, the next question is, can kidney failure be reversed? Now, it depends on the stage. Kidney failure is in stage 1 to about 5. So depend on the stage where it is noticed. Remember the early signs I pointed out. If you didn't capture it, you can go backward and take note of the early signs I pointed out. So in the early stage, it can be, stopped by, avoiding those things that are triggering it, and it's reversible at that stage. But when it gets to advanced stage where both kidneys are dead and no longer functioning anymore, that's when you now have to rely on dialysis. You now have to rely on dialysis and kidney, or maybe they will do what they call kidney transplants and so on. Next question, does dialysis means the kidneys are dead? No, sometimes the kidneys are not dead, just that they are not being active, they're not doing efficient enough to carry out their activities. So because it's not, when you're supposed to do 100% and you're doing 40%, there will be backlog and it will be accumulated day after day. So the dialysis just needs to assist. Yes, some people have to do that as often based on the prescription and based on how the kidney is functioning. It will also demand how frequent it would be. Yes, so it's just an external support to the kidney. Sometimes the kidneys does not mean the kidneys are dead. Next question, what should people with kidney disease avoid? First, self-medication. All these painkillers, they can harm your kidney. Avoid them. Some of us abuse it a lot. These painkillers, it can harm your kidney. So the next one is unverified herbal products. Unverified herbal products that are, we have a regulatory body called NAFDAC, and NAFDAC are the ones that are supposed to verify, approve certain products. They go through testings to see that these are not harmful. So if these products are unverified, avoid taking them, because though they may be promising they can do this and that, they can also harm you and harm your kidneys. Avoid it. Excess salt intake, processed food, those can avoid. Remember, I told you the current causes of, if you can rewind back to this video, you will see the current causes I listed. So excess salt intake aggravates and can affect the kidney. And when you have poor blood pressure control or poor blood sugar control, remember, hypertension is there, diabetes, if they are not well managed, can lead to kidney failure. So as a nurse, it is non-negotiable for us to ensure that we protect our kidneys. They are so valuable. If you ask someone today, a patient to the dialysis, they wish they could rewind to when their kidneys were functioning. You don't want to get there. Of course, people may have, it takes a lot to even do a transplant if you can ever see a donor. So while you have healthy kidneys, please take good care of them. If you love these contents we share on health tips and the rest, please subscribe, share these contents to your friends, someone near you, so that we can get to grow together, avoiding certain things and staying healthier. Thank you.